Re-examination of former Life Esidimeni Managing Director Dr Morgan Mkhatshwa continues. Yesterday he conceded that patients, some of them children, died at the centre before they were transferred to other NGOs. This after the Gauteng Department of Health terminated its contract with the centre in 2016. For more, let's bring in SABC News senior reporter Chriselda. A very good morning to you, Chriselda. Day 3, how's it going so far?
Well, Desiree, you recall yesterday that the inquest had heard how some patients who left Life Esidimeni facilities arrived at NGOs without reports of their medical history. So this is what lawyers representing Takalani and the Masigo home for the elderly in Krugersdorp had basically told the court. You'd recall, Desiree, 37 mental health care users had died at both homes during the crisis, while 37 of them passed away. It's unclear how the deaths were spread between the two homes. So lawyers representing Takalani and Masigo told the court that some patients only arrived at their facilities from Life Esidimeni with minimal information about their medical history, and those that did arrive with something had arrived basically with very little detail. The former managing director of Life Esidimeni basically disputing this. He says the patients left his facilities with adequate information. And you'd recall Daphne Ndlovu, who was a social worker at the Cullinan Rehabilitation Centre. She testified during the arbitration hearings which were led by retired Justice Dikgang Moseneke. Her lawyer told the inquest of a staggering number of patients who arrived at their facility from Life Esidimeni without discharge summaries. Let's take a listen.
Doctor, the point that I'm trying to make before this honorable court, like I've already said, is that my client, Daphne Ndlovu, she's going to testify that 60% of the patients that Cullinan Care and Rehabilitation Center received from Life Esidimeni, they did not have medical records. That is the point I'm making before the court.
My lady, I will reiterate, it was not my responsibility to manage in transit of the mental health care users and their documentation. I therefore would like to state that it was not the responsibility of Life Esidimeni to manage patients and documents in transit. They were handed over to the Department of Health officials.
Well, Desiree, while re-examination of the former managing director of Life Esidimeni continues here this morning, we're expecting a bit later on, shortly after lunch, I understand, a former head nurse at the Waverley Care Centre is expected to take the stand. She's expected to basically tell the inquest about, what she found pertaining to the patients, what condition they were in. You'd recall that over the past few days, there'd been questions raised about the condition or the health of the patients even before they'd left Life Esidimeni. We also heard that when the mental health directorate officials had made surprise visits to some of the facilities at Life Esidimeni, they'd found that they'd been undernourished, some of the patients had been frail. So it's really a question at this point about, when the health of these mental health care users had deteriorated, was it at Life Esidimeni or was it at the time or even after they'd been transferred to these healthcare facilities, which were later found not to have any proper registration?
Chriselda, you covered the story extensively during the Moseneke hearings. Any parallels you're able to make between that and this legal process, and any new information coming out?
Desiree, what is quite striking at this particular point, most of what we're hearing at this time is a repetition of what we heard during the arbitration hearings that were led by retired Justice Dikgang Moseneke. But what we're starting to see now is that there seems to be somewhat a blame shifting that is taking place, because a lot of what we've been hearing over the past few days is lawyers representing some of these NGOs that were implicated or where some of these patients had died. These lawyers representing those NGOs are basically saying, wait a minute, in fact, when the patients arrived at our facilities, they did not have the proper medical documentation. They arrived here already looking frail. They arrived here already, their health looked like it had been deteriorating. So it's really going to have to be a tussle between trying to determine who should be held responsible. Remember, that's why this inquest has been set up, is to determine who should be held criminally responsible for the deaths of the 144 patients. So at this particular point, there seems to be a whole lot of a shifting of blame. While we heard during the arbitration hearings from the families as well that the Gauteng Department of Health had basically not properly consulted them when the patients were being transferred. Yesterday we heard from Dr Mkhatshwa that he'd received a list of those who were meant to be transferred only a day before those transfers had taken place. So quite striking at this particular point that while we heard during the arbitration hearings a lot of the pain and the grief that the family had gone through and how they were not consulted, allegedly not consulted by the Gauteng Department of Health properly before the transfers had taken place, now we're hearing a lot in terms of what the NGOs have to say. They're basically saying, wait a minute, Life Esidimeni had brought these patients here without any proper documentation. So you ask yourself, in terms of mental health care users, obviously there's going to be a lot of care that is needed there. The documentation with which they were discharged at Life Esidimeni was going to be crucial on how they were going to be cared for wherever it is that they were being taken. So these NGOs are basically saying that a lot more responsibility needs to be taken by Life Esidimeni, because they believe that the documentation that was brought, if at all, with some of the patients was inadequate.
Chriselda, thank you so much for bringing us up to speed. Of course, we'll continue to watch.